Thank you for tuning in to the Into the Classroom series produced by Mental Health California, sponsored by Blue Shield of California's Blue Sky Initiative.
Welcome to Into the Classroom, a student mental health awareness multimedia series produced by Mental Health California. I'm your host, Conrad Crump, also known as Coach Crump, and today's topic is on college students and anxiety. Now, today we'll talk about the unique challenges and pressures that contribute to anxiety in college students. We'll also explore the impact of academic stress, social pressures, and the transition to independence on students' mental health. We'll also learn about strategies for managing anxiety, seeking support, and promoting mental well being on college campuses. Now, our goal today is to shed light on this important topic and to identify ways to empower college students to navigate their academic journey with resilience and self care. I'd like to introduce our clinician today, Miss Ali Garza. Ali is a licensed clinical social worker on faculty with the Department of Psychiatry at the University of Colorado. She has expertise in youth suicide prevention, crisis intervention, supporting parents and families, and treating OCD and anxiety related disorders. Welcome today, Ali. How are you?
Doing good. Thanks for having me again.
Absolutely. Always a pleasure. And at this time, I'd also like to introduce our youth guests for today's session. Today, we have with us Monica Tamayo from the University of California at Los Angeles. Hey, Monica, how's it going?
Hey, Coach Crump, it's going good.
Good to see you. I'd also like to introduce Kenji Ellsworth, a student at American River College. Hey there, Kenji, welcome.
Hello.
And we also have with us Joel Suazo from Los Angeles City College. What's up, Joel? How's it going?
Hello, everyone. I'm doing well.
Good. And last but certainly not least, we have with us Randy Rosemond from Texas Southern University. What's up, Randy? How are you?
Hey, everybody. I'm good.
Great. Now, before we get into the depths of this topic, I'd actually like to turn it over to Ali and ask her if she can provide some brief clinical insights into students and anxiety and how it's influenced by various factors, including familial, hereditary, social, technological, and other environmental aspects. Ali, take it away.
Yeah, absolutely. So anxiety disorders and any other type of mental health disorder is always a mix of nature and nurture. So genetics and then different kind of environmental or situational factors that tend to bring on the level of impairment that comes with a disorder. Some of the things that make college a particularly vulnerable time for folks being diagnosed with anxiety disorders is that is a huge time of change. It's a time in which people are transitioning from having these systems that are set up in high school and then kind of getting the rug ripped out from underneath them in a lot of cases, as far as how do I take the skills, take the systems I had in high school and apply them to a new environment with new people oftentimes, and also sometimes in a different city or a state. So for those reasons, we tend to see it come up in also like middle school, early high school age, but then the second most common time is that college time. So
Yeah, thank you so much for that, Ali. That was very informative and so true. I mean, having that rug pulled from under you, the systems that you're used to in high school and then transitioning to something totally new is definitely a cause to raise, anxiety. At this time, I'd actually like to ask everyone with us in this space that's on camera, just by a show of hands, if you have dealt with or are currently dealing with anxiety. All right. And so I can see that I'm not alone, as well as many of the others on this call. So let's go ahead and go into our slide presentation to gain more information on this topic, as well as looking at treatment solutions for wellness. So a prevalent mental health issue among college students, as we obviously know, is anxiety. A national college health assessment was done and found that anxiety is the most common mental health concern reported by college students. Let's go to our next slide. So young folks experiencing anxiety may demonstrate specific behavioral features and patterns, including excessive worrying, difficulty concentrating, restlessness, difficulty sleeping, and other physical symptoms like headaches and stomach aches. Let's go to our next slide. So we know that the origins of anxiety are far and wide. However, young folks can actually be predisposed genetically given their family history, which can lead them to developing anxiety. And also know that high familial expectations can be another contribution to anxiety as well. Next slide. So when it comes to those social factors that contribute to anxiety amongst college students, I'd like to ask our clinician, Allie, if she can elaborate on what some of those social factors might include.
Yeah, absolutely. I think something that is unique about social media is that unlike any time before, social media gives us an avenue to have tons of information, tons of opportunities, unfortunately, to compare ourselves to others. When anxiety is also in the mix, this creates this cycle of seeing different types of pictures, posts, and all these things. And our brains are technically have this tendency to be predispositioned to look for negative, to look for those things. And when anxiety is already part of what you're dealing with, it will latch on to those opportunities. I think something that's also unique about social media and technology in general is that it is very stimulating. A lot of times people with anxiety, especially who are dealing with severe anxiety, they are looking for any means to try to avoid the experience of anxiety. And it's kind of like pushing a beach ball underwater, that the more we try to shove anxiety away, to ignore it, to pretend it's not there, the stronger it gets. And I think social media, especially, when you're swiping constantly and it's all this stimulating information, it's really easy to try to use that. And therefore, it has this backwards effect of making anxiety maybe bigger and not being able to address it as you would normally.
Wow. No, thank you very much for that, Ali. I mean, that is very informative. Great information. I like that visual that you've given me of trying to push a beach ball underwater. It's inevitable. It's going to come back up. Wow. So I'd actually like to ask some of our young folks that are on the call today if they can elaborate on how social media can exacerbate anxiety. And I'd like to start with you first, Randy.
I definitely think that social media plays a part in anxiety in our generation, and anybody who is on social media. When we see younger people or the younger generation, a lot of people tend to blow up nowadays, and they're traveling the world, and they're getting boatloads of money and stuff, and they're flaunting it and posting it, and they're living a dream, and that's like the new goal. It's very natural and hard to not kind of compare yourself and want or wish to do what they're doing, and kind of look at your own life and see the difference. But as they're posting their stuff, your life still continues. But since they're getting all these new opportunities and it's out for everyone to see, it's very easy to get mixed up in that with the comparisons.
Very true. Very true. And what's funny is that oftentimes we see these images on social media. We don't know how many takes it took them to get that perfect shot, or we don't know what's outside of their screen of what the camera is showing us, right? But we tend to see what we see and we believe it, and it's actually something that does something to us. Like Ali said, it's a stimulative effect. So I actually like to pivot to you, Joel, and ask you for your insight or your feedback on how social media might exacerbate anxiety.
Yeah, so social media is definitely one of those things that is, can cause anxiety if you don't use it the right way. Sometimes you might see someone going on vacations or having a lot of money or going constantly out with friends, partying, eating food, all the highlights aspects of life. At the end of the day, you don't know what that person did behind the camera, off camera to have a lifestyle like that. I would also say, they constantly compare their lifestyle. Why does this person have a Ferrari, for example, and I don't have a Ferrari yet? um, you know, and I would also say that, people can also get like an information overload. At times, when keeping up with notifications and the news and stories and all this, it can be a super overload for someone who is, for someone's brain who is still developing and can, cause a lot of stress and anxiety.
Wow. Thanks a lot for that insight. That's real talk. Everything you just said was spot on. Thank you both. So let's go ahead and move on to our next slide. So it is no secret that environmental factors, cultural pressures, traumatic experiences, and even socioeconomic realities can contribute to anxiety. It is especially important to note that students from marginalized communities may face additional stressors, often related to discrimination or even intergenerational conflicts, which can also impact their anxiety levels. Let's go on to our next slide. So, when we look at anxiety among college students in the United States, the research shows that anxiety rates tend to be higher among younger college students, particularly those who are freshmen or those who are trying to adjust to new academic and new social environments. So, I'd like to pivot to you, Monica. Would you care to just share with us your experience as a freshman at your campus at UCLA?
Yes, of course. So it was very difficult doing the transition from high school to a 4 year university, especially because I am a first year generation college student and I hope to be a first year generation college graduate. But it's been difficult because I haven't had anybody close to me to be able to ask for advice or to get that help that I need in order to transition. So, for example, like studying, I didn't have anyone to tell me exactly what I needed to do, how to study, tips and tricks, all of that. Unfortunately, in high school, we did have a few resources, but it wasn't enough of those. Like my roommate, my freshman roommate, where she was fortunate enough to have both of her parents graduate with their masters. Her cousins, like her uncles, like all of them, like she came from a well-educated family. So, and I did see those differences between us. Like, she already had her study habits going into college. I had to learn those. Even now, as a third year student in college, I feel like I'm barely getting in my zone. I'm barely getting my routine together, and it's taken me a lot longer because I didn't have that growing up.
Wow, thanks a lot for that feedback, Monica. And I definitely feel you on the pressure of being a first generation college student. And yes, you will be a first generation college graduate. That's something I definitely remember myself, the anxiety just going through the roof, not really knowing who to talk to, just because it was just like a first, brand new adventure. So certainly can relate. Let me ask you, Randy, would you care to share your experience when you started at your university?
Yeah, so I originally started at American River College and then I transferred over to Texas Southern University. So I've kind of had two different first year experiences. After going from American River College, the community college in California, that was a different experience because I was going straight out of high school to that. It is very much different than high school. I had to deal with different study habits and a new campus and figuring out where to go. And I kind of underestimated how big the campus would be and where I need to find my classes and kind of preempting myself of where I need to be so I can make my classes on time. And then when I got to TSU, Texas Southern University, it was like that times 10. So it was a new experience as well, but I was able to already be used to getting a new routine down, since I wasn't used to that before. As well as dealing with new people in different surroundings and environments, and it was all just super new. But you get used to it after a couple months, I think.
All right. Well, thank you. Thank you both for that feedback. That's very helpful for myself as well as for the folks in the audience that may be listening in. Let's go ahead and go to our next slide. Now, when it comes to ethnic and cultural factors as it relates to anxiety, studies have shown that certain ethnic groups, such as Asian Americans and African Americans, may experience higher rates of anxiety due to cultural expectations and racial discrimination. As we've heard, different expectations from family, to make sure you succeed. This is you're the first in the family to kind of forge this path. So that's something that, is really true and can certainly cause higher rates of anxiety, as well as the racial discriminatory, factors that are at play for college students trying to, navigate this path of college. That's something that certainly can increase their anxiety as well. Let's go ahead and go on to our next slide. So when we talk about support and looking at support from schools and colleges, many schools have recognized that there is a huge importance for mental health and the need for programs to address anxiety amongst their students. Education, intervention, and support for young folks is certainly necessary to help address anxiety. And these initiatives aim to reduce the stigma, increase awareness, and provide students with knowledge and skills to manage their anxiety effectively. So, Joel, I'd like to ask you, what types of supports are you seeing on your campus?
On my campus, I've seen a lot of support with, help from tutors, teachers, having sessions where everyone works on homework together. Everyone works on, studying for midterms and finals that they need to pass. I've also seen, multiple bulletins or little flyers around that, if you need help with mental health, if you need to talk to anyone, there is a therapist on campus that you can access and speak to them if you're having any difficulties with school.
Wonderful. So support does exist, and that's good to know. I'd actually like to ask Allie, our clinician, what might some of those other types of supports for students with anxiety look like?
Yeah, I'm a little biased because I work for a university, but I would say that these university systems and college systems are great means of resources in getting connected to evidence-based care for a couple different reasons. One, unlike other systems of mental health or other types of clinics that might be in your community, these universities and colleges provide accessible care. As far as I know from my program, for example, we accept Medicaid and pretty much any insurance, actually, I would say. And so that accessibility piece is huge, of being able to know that you can go to your college campus and ask to see someone that's through that system. And I think also the second piece is that these schools and universities are well connected with other campuses and programs. So for example, the type of work I do with people who have OCD and severe anxiety, it's a very specialized type of treatment. So even if a person went to like a smaller college in Colorado and was like, hey, I want to get connected to care, it wouldn't take much effort, if any at all, for them to connect with us and be like, hey, let's get this person set up. So I think that the fact that they lower those barriers and make it easier, and also they're so interconnected compared to other programs or clinics that are kind of more single places, is really a huge asset. And along with that, the ability for them to work with like the school admin as far as like accommodations and getting you any sort of resources. There's a lot of people that can kind of rally behind you through universities and colleges.
Yeah, that's really good to know. And just having the mindset of looking at universities or even community colleges as resources for community, right? I mean, not just for students, but for young folks who may not even be attending those schools, being able to know that they can go there to also find support. So that, I think, is really huge. definitely a good piece of information. And so we've already talked about, the need to establish different types of supports, as well as peer support programs, which is something that, is important as well. Their students can connect with folks who are like them or have, similar experiences, and seek that guidance from their peers, who have faced similar challenges. It's always helpful when there's someone else who's gone through it that can kind of walk you through what you're currently going through. So let's go ahead and go to our next slide. So looking at culturally appropriate treatment, Ali, I'd like to ask you, pivot right back to you again, if you can maybe elaborate on some of the culturally appropriate treatment practices and what some of those practices might look like.
Yeah, absolutely. I would say that more so now than ever before, people are being very intentional about creating resources and clinics that are culturally appropriate or culturally specific. I know when I was back working in Portland, we had a clinic that was entirely focused for the Asian community, and there were so many incredible opportunities to connect people with maybe having family therapy with their parents who speak a different language, and having a therapist that also speaks that language, and all these barriers that could get in the way in quality care. So as far as, I think there's a huge need to continue to grow that resource list and create these programs so that your cultural beliefs and practices aren't A, pathologized, but B, that you're also understood by your clinician, as I think anyone would want to, be able to go into therapy and be like, this person, I don't feel like I need to explain this about myself. There's a huge relief that can come with that for a wide variety of identities.
Absolutely. Yeah, thanks for that, Ali. And there's a saying, it's what's understood doesn't need to be said. And oftentimes when you are in a space with someone who has that cultural competency, they already understand. So, it's something that is really a huge benefit of being able to seek that support that you need. So let's go ahead and go to our next slide. So looking at interventions and treatment solutions, another aspect is cognitive behavioral therapy, CBT. It's a widely used approach that focuses on identifying and changing negative thought patterns and behaviors associated with anxiety. CBT actually equips individuals with coping mechanisms and problem-solving skills to navigate anxiety-inducing situations. So something to certainly benefit from as well. Let's go on to our next slide. All right. And we also see that therapy is another resource for our young folks, whether it be individual or group counseling or therapy. This type of mode of resource for anxiety can provide a safe space for young people to really express their feelings, gain support, and learn effective coping strategies. So let's go on to our next slide. And we also see that there are natural and holistic remedies for anxiety, such as exercise, yoga, mindfulness, meditation, and more. I'd actually like to ask some of our young folks, what are your self-care remedies or some of your self-care practices that help you ease your anxiety? So I'll start with you first, Monica.
To have this giant water bottle. It's called a hydro jug. And I make sure that I drink at least one of those per day because it's important to stay hydrated. I also make sure that I take time for myself, do things that I enjoy, things that do not have to do anything with school, so that I can really just be in like peaceful thoughts.
Definitely got to stay hydrated. Definitely need to have peaceful thoughts. I'm with you on that. Let's go to you, Joel. You got any self-care tips or remedies?
Yeah, like on the slide that we previously looked at, exercise is definitely a good one. Sometimes I like to go out on walks, or I like to go to the park, maybe go play basketball or soccer, just to get the blood pumping, and overall, some like not focusing on either my academic studies or something that needs to be turned in tomorrow, or if I have a test, or etc. So
let me ask you, Randy. How about you?
Yeah, so I'd like to agree. Music is definitely a big part for me. It helps me a lot to, focus on the lyrics and how much I love the song and the beat and the artist, just everything about it. I'm just a music lover. I also like to read, so reading and kind of transporting myself into a different world, almost is just like really enjoyable for me as well. Working out is cool too, and also going for a drive. I think just driving and like listening to your music and maybe just going to get like a quick beverage or something like that, a quick snack, can definitely help do wonders, honestly, just taking like that little part of yourself from the day to you.
Yeah, I totally agree about the snack part. Definitely, and healthy snacks, of course, but being a foodie myself, I certainly enjoy taking my mind off of things and actually preparing food. Cooking food is something that actually brings me joy, makes me happy, and it's something that I use as a self-care remedy when I, need to ease my anxiety. So, Ali, let me pivot to you. We've heard some great tips from our young folks on different remedies, strategies, self care tips. Might you be able to talk to us about other remedies or maybe even other resources for young folks who might be listening in our audience today?
Yeah, absolutely. And I think all these things that would fall under like the self care umbrella, I would consider them or call them like supplementary as far as like, you know, especially if you have anxiety to the point that you have an actual anxiety disorder, you're going to need evidence based treatment. There's no way to self care your way necessarily. I mean, I wouldn't recommend that as a clinician, but rather having evidence based treatment and incorporating these. They're kind of these important pieces to the puzzle and setting yourself up in a way that's helpful. So I think you all covered a lot of different ones that I also hear across the board as far as like some type of intentional movement, some type of like creative outlet, doing things that instill a sense of mastery. So working on skills, some people it's like playing an instrument or learning a language. And then also means of finding social connection. So whether that's I know I can relate to Randy as far as I love to go on a good drive, get a little treat, and call a friend. And so figuring out ways to incorporate that into your day-to-day life. And then if it gets to the point that like you're noticing these symptoms and that it's so like that it's debilitating and impairing, then incorporating evidence-based treatment alongside with all those different pieces and continuing to maintain those is kind of one of the biggest challenges when mental health gets really like strong and really impairing. So coming up with plans of how you can incorporate your loved ones people that care about you into engaging into these activities.
Yes, yes, and yes. I personally totally agree with the social aspect. Finding your people, right? I mean, even if it's just one other person, just having someone to talk to kind of just explain what you're feeling, even the aspect of talking about it helps to relieve and release some of that anxiety and kind of just get it off your chest. Oftentimes it's bottled up. Oftentimes it's like that beach ball that's under the water that's, trying to come back up. So it's certainly important to have folks that you can talk to, as well as employing these other methods like music or exercise or just going for a walk or, making some nice dishes or going on a drive, right? All of these things can certainly help ease the anxiety and get you through whatever the situation might be. So, I want to thank you all. I want to personally thank you, Monica, for sharing your experience. I appreciate you. Thank you, Joel, as well. Great insights and feedback. And I also want to thank you, Randy, just for sharing with your experience today. And last but not least, I definitely want to thank Ali, just for having that wisdom and the knowledge to just kind of wrap it all together, with this conversation, because it truly is important, for our young folks to learn ways to ease their anxiety. I also want to give a huge thank you to our audience for joining Into the Classroom, which is a production of Mental Health California. Please be sure to visit us at mentalhealthca.org. To access health and mental wellness topics for boys and men of color, please visit our signature initiative at brotherbewell.com and be sure to subscribe to our blog there. And I also want to give a huge thank you to our sponsor, Blue Shield of California's Blue Sky Initiative, which promotes access to mental health support. So you can learn all about their program at bluesky.blueshieldca.com. And with that, I'm your host, Conrad Crump, aka Coach Crump. Until next time, take good care of yourselves.